This presentation on electrocardiography is part of your lab work. Obviously, you can't do an electrocardiogram because you don't have the machine or the instrument there. But I always include this in a laboratory experience in anatomy and physiology, so I'm making this presentation for that very reason. So it's part of the lab work. Watching this video is part of the lab work. There's going to be two more that you can actually do. There's going to be a presentation on blood pressure, and you can actually do that. You can take blood pressure on yourself or on other people. And the third one is listening to heart sounds, and you can do that one too. But this one, it's gonna be a dry lab experience, but it is part of the lab, so that you know that. Okay, the first thing, what is an ECG or electrocardiogram? It is a recording of the electrical activity of the heart. See that line right there? It's a recording of the electrical activity of the heart. And it's to show whether the heart is working properly or not. It records the electrical activity in terms of its rhythm and in terms of its activity, and it's usually recorded on a strip of paper, and it's used to diagnose various heart diseases. And here's an electrocardiogram machine, and then here are the hookups to the person on the right arm, their left arm, their right leg, their left leg, and then also there's 6 chest leads, which we'll look at more closely. So there's 12 leads, 12 different looks at the electrical activity of the heart. And it's like observing something from 12 different directions, so you can see how well the heart is working or how well it's not working. Okay, so here we see a recording of an electrocardiogram, and we see that's a lead 2 recording. The electrocardiogram has 12 leads, okay, and 6 of them are chest leads. We'll look at those more closely in a minute. 1, 2, 3, 4, 5, 6. See, they're all going down there, but he also will have to, he's not hooked up on this picture. I didn't realize that. He also needs a lead on his right arm, a lead on his left arm, and leads on his legs. That's the complete hookup. But electrocardiogram has 12 leads. And here's what it looks like. This is a lead 2 electrocardiogram, which is a normal pattern. There's a P wave, then there's a QRS complex, and then there's a T wave. And what's represented here on the electrocardiogram, the lead 2, the P wave is atrial depolarization. The QRS is ventricular depolarization, and the T wave is ventricular repolarization. What is not represented on this electrocardiogram, and you can't see it because it's small, is the atrial repolarization, because atrial repolarization takes place during the QRS event, and it's a very small event, so it gets covered up. You can't, it's like trying to hear a pin drop at a rock concert. The pin dropped, but you couldn't hear it. Atrial repolarization occurs, but you can't see it. So let's review. The P wave is what? It's atrial depolarization. Okay. Then the QRS is ventricular depolarization. And it's the big one because ventricles are bigger chambers. And then the T wave is ventricular repolarization. And you can't see atrial repolarization because it occurs at the same time as ventricular depolarization. See, here's the actual electrocardiogram recording. See, and it's a lead 2. So a little weak P wave, but then a good QRS T wave. And then it repeats, P, QRS, T. Guy's got a good rhythm. It's regular and it's on time. In a arrhythmic heart, it would be different time intervals between them, and there would also be different patterns occurring. This is a good regular pattern, and it's a good rhythm. So now, in conclusion, remember the electrocardiogram is a test to measure what the electrical activity of the heart, to show whether the heart is working properly or not. It records the heart's rhythm and the activity on a strip of paper, and that makes it easy for the doctor to diagnose the condition. There are 12 leads on a normal electrocardiogram, and that's like looking at the heart from 12 different directions. Very useful in helping to diagnose any heart problem.